So we're operating on these two children on Wednesday, and we're listening to a Western-leaning radio station, and they start making little jokes like air raid signals on the show. And then they come on and go, we're only fooling. Well, we did the second case, and 15 minutes after sundown, those same noises came on, but they weren't coming from the radio. They were real. And within 30 seconds, we could feel the bombs falling. Literally, it's thunder and it's a shake, and they get closer and closer until the windows start rattling and things start falling off the shelves. When that happened, I looked up and I said to my Serbian colleagues, I said, listen, my country's gonna kill a lot of your countrymen tonight, but there's a child in front of us that is not going to die as a result of this bombing. We're gonna finish this operation, and you guys can all leave the minute we come off bypass and go home. And they all looked up to the person and said, we're gonna make sure the kid gets to the ICU, then we'll go home.
What drives you, and how do you pull off these trips that logistically and quite frankly from a safety perspective, they're not exactly safe?
Well, we do a risk assessment. Sometimes we use professionals, and sometimes we use our people that are on the ground. We get the risk assessment and we make the decision whether we're going to go or we're not going to go. We have been fortunate to have chosen wisely in most cases, not in all cases. Nobody's ever been injured. Nobody's ever been kidnapped or captured or anything like that. But we've had a few close calls where, you know, troops had to be called over a road so they could get us out of town to another airport. Whenever we go into a country where bad things happen, we do have a plan with the Ministry of the Interior on how to get us out. And you got to keep up with the news constantly.
And you know what's remarkable listening to all of your stories, and I just want everyone to realize that these logistical problems are not nearly as difficult as some of these surgeries that you and your team are performing. And I think that that's what's so special about this. And you think about heart surgery in an adult, then you think about heart surgery on an infant with congenital heart defects. And not only the breadth of the surgeries you all perform, but I really thank you for all of that work. I could talk to you right now for 10 hours because I can just tell you have so many stories because you put yourself on the line so many times. Thank you for that commitment. Thank you for that dedication.
Thank you.
Dr. Novick, we have a surprise for you. An anonymous donor is donating $10,000 to the Novick Cardiac Alliance.
Wow.
Also, your friend, Sara, has something she'd like to say to you.
So I had childhood heart disease, and thankfully I had access to care when I needed it, and I don't take that for granted. So today, my husband and I would like to match the first $100,000 of donations that come into your foundation from this show in support of your stunning humanitarianism.
That's fantastic. That is absolutely fantastic, Sara. You and Sean have been really good supporters over the years, and this is a big jump in support, and hopefully we can find some people that'll match that $100,000.
Yeah. Well, and Sara, thank you for that. And you know, I also just want to highlight that you're a shining, living example of when a child gets the surgery they need, they can go on to live a full, happy, wonderful life. And Dr. Novick, you're providing this for so many kids who would otherwise not have that opportunity. I would just urge everyone out there to also donate. You can find out about more information on how you can donate to the Novick Cardiac Alliance by visiting our website, thedoctorstv.com. And just remember, any amount you give will be doubled. No amount is too small. Sara, thank you. But Dr. Novick, more than anything, keep up the great work. And best to you and your entire team.